the cliche phrase you've heard us say, lucky to be alive. Well, it probably gets used way too often, but in this case, it is certainly appropriate. Take a look at this photo. This is the St. Clair County woman's car just after she was hit head on by a drunk driver, and her son walked away with just a few scratches. Lawren Ruiz had catastrophic injuries, though.
But as she says herself, someone had different plans for her, and there's a good chance it's because of the career that she was about to begin.
Hi, Wayne. Almost done. Almost done. Good. 98.2. That's almost perfect.
Ask any nurse and they'll tell you no 2 days are alike.
So he did go down this morning for a 2-view chest x-ray.
Especially
weeks. I had weeks of no memory.
When you become the patient.
I had a traumatic brain injury.
February 21st, 2021. Lawren Ruiz was driving home with her son in the front seat on M25 near Lakeport.
We were in a no passing zone, and the driver of the other car was heading at us and passed a truck and hit us head on.
The driver of the other car was drunk. He and his passenger died instantly. Somehow, Lauren's son Rowan walked away, but she suffered a traumatic brain injury with a brain bleed, a severed artery in her leg, broken bones sticking out of her leg, and much more.
Her leg was what we call limb threatening, so it's an orthopedic emergency. Not only that, but she had other non-orthopedic injuries, so it truly was a life-threatening situation.
Paramedics rushed her to McLaren Port Huron, then quickly realized she needed more extensive care and brought her to McLaren Macomb. By then, she was intubated and sedated.
I severed my popliteal artery, which is the artery that runs right behind your knee. So I was losing pulses. I didn't have any pulses in my feet.
Doctors were not sure they could save her leg, but fortunately her brain injuries had stabilized and they were able to try.
She's extremely lucky. The accident was horrific.
Dr. Jamie Giliberto is Lauren's vascular surgeon. The EMTs recognized Lauren's artery was severed and her lower leg had no pulse, so he knew exactly what needed to be done.
We had to take a vein from the leg, from the same leg, and use that to bypass the arteries. Just like heart surgeons take veins from the leg to bypass the heart, we did the same thing to bypass this leg.
Then Dr. Chris Vitale, the orthopedic trauma surgeon, jumped in, repairing every broken bone, essentially rebuilding her leg from knee to ankle. Lawren survived hours in the operating room.
She's a true survivor. She is one of the strongest patients I know, and so the second that I talked to her in the ICU when she woke up, I knew that she was going to have a successful outcome.
There's Mama.
Just how successful, nobody knew, though. When the accident happened, Lawren was in nursing school. At 40 years old, she wanted a career change, something more fulfilling, and the school let her finish a little off schedule. Now, she is an ICU nurse at McLaren Port Huron, the first hospital she was in after the accident.
It sucks to be a patient. It's not great. So when you have people that are nothing but uplifting and understanding, it's so helpful. So I just try to give back as much of that as I can. So this was the initial surgery.
And even though she has the scars to prove her past, she is writing her own future. Here they won't call it irony, though. To them, it's fate.
I think that she was put in a situation that someone knew that she could handle, and I think that she is going to turn this into a very positive experience for others.
Nursing is the kind of career that I can always help people. I can always try to help them feel better, make their lives a little better. Thank you, Wayne.
In Port Huron, Nick Monticelli.
Oh, I just love him.
Local 4 News Today.